Hello and welcome to Lynchburg Live. I'm your host, Linda Smith. According to the American Cancer Society, skin cancer is the most common of all cancers and accounts for nearly half of all cancers in the United States. This is a concern for us, not only in the summer months when we're exposed more to the sun, but all year round. My guest tonight is plastic surgeon Dr. Timothy Sylvester, who will be giving us an overview of skin cancer, its causes, and treatments. Tim, welcome to Lynchburg Live again.
Well, thank you.
You know, everybody, I'm sure, has heard of skin cancer. And I think we hear more about it in the summer months because of sun exposure and that sort of thing. But could you just tell our audience what skin cancer is exactly?
Sure. Skin cancer is an abnormal growth of cells, and in this case, it's in the skin. These are malignant cells, and so, like any cancer, they are dangerous, and early detection is a key to cure and survivability.
And there are several kinds of skin cancer.
Correct. There are three main skin cancers. Basal cell, squamous cell, and melanoma. There are 4 or 5, maybe more other types of skin cancer that are much less common, such as a cutaneous T-cell lymphoma. They have complicated names even. We don't see these very often. In my career, I've seen some of these 2 or 3 times over 35 years.
So what is most common skin cancer?
Basal cell carcinoma is the most common, and I've reviewed some statistics recently, and it's estimated that 70 to 75% of skin cancers are basal cell carcinomas. Squamous cell account for 20 to 25, and the malignant melanoma is in the 2 to 3% category.
So what is the cause? I mean, we hear so much about smoking causes lung cancer, and some things you eat are bad for colon cancer. So what's the cause?
The number one causative agent is UV rays or sun exposure, and one article I read said that it accounts for up to 90%. Now, how you measure that it's a little difficult to measure that, but it's estimated that 90% are caused by skin. Well, most of these skin cancers, particularly the basal and squamous cell, appear on parts of the body that are more commonly exposed to the sun, like the backs of the hands, the face, the neck, the anterior chest, and that's one of the reasons it's implicated.
So, all right, now I recently heard the term incidental exposure. How important is that? How dangerous is it?
I think it's a function of how long you're exposed to something. For example, if someone walks to their mailbox and back, and it takes 15, 20 seconds, it's not bad. If you like to take a stroll that takes 2 hours on the beach, that would be a bad thing. You know what I mean? It's
right.
I think more than anything, it has to do with the length of time and the time of day you're exposed to sun.
I wouldn't expect that most people who are in their home for the day are thinking about putting on skin blocks, sun blocks, just to walk out and say, have a 15-minute conversation with a neighbor.
I mean, I feel that way too. And sometimes you get surprised. You go to do something thinking it'll take 5 or 10 minutes and don't put your sunblock on. Of course, the fairer complected you are, the more at risk you are from sun exposure. And as our pigment, as skin pigments darken, you're at less risk for skin cancer.
Are there skin cancers that are not caused by the sun or not caused by UV rays?
Yes. I think, although I was going to say melanomas may or may not, because we see melanomas and these other cancers on parts of the body where someone says, I've never exposed this to the sun, something beneath a swim trunk or something.
Bottom of the foot. I have
right,
a friend who
bottom
had
of the foot. So definitely there are some that are caused by things other than sun exposure.
But you just can't pinpoint them all, I'm sure.
You mean what are the other causes?
I mean, like things like a melanoma that shows up on your foot. It would be hard. You'd be hard put to try to track down a reason for that.
Exactly. Now we do know, besides sun rays, that areas of chronic injury are more likely to develop. For example, there's a cancer called a Marjolins ulcer, which is a name for a squamous cell that develops in an old burn wound. These oftentimes are 20 to 30 years after the burn wound, and patients will then develop a squamous cell in that. May not have been exposed to the sun, so it's thought that the constant and recurrent injury causes the change in the cells to a malignancy.
That's really interesting. I mean,
Yeah.
didn't know anything about that.
Well, just like other irritants like smoking, nicotine, tobacco, tars, things like that are implicated, of course, in lung cancer.
Which reminds me, smoking. Everything that we hear, it causes everything
Right.
from fleas to cancer. Is that an issue with skin cancer?
Particularly with lip and oral cancers.
Okay.
Pipe smokers, for example, have an increased incidence of lip cancer. All types of smoke have increased incidence of mucous membrane and mouth and throat cancer. So smoking definitely is a causative agent for skin cancer too.
Right, how about in geographical locations? Are there specific ones that you see more skin cancers?
I've seen an article that said as you approximate the equator, the incidence of all types of cancers, and particularly melanomas, seem to increase. And I think it's a function of more sun exposure.
Now, starting off, when I introduced you, I said something that I had found when I was researching this show, that skin cancer is the most commonly diagnosed cancer in this country.
The numbers I saw, that 40 to 50% of all cancers are skin cancers. It's estimated that somewhere between 40 and 50% of adults are likely to be diagnosed with a skin cancer by the age of 65. And of course, some people have multiple skin cancers, people who have spent long periods of time outdoors, that they're farmers, for example, or that their occupation requires them to be out, and particularly the older population who, 50, 60 years ago, we didn't worry about it all that much, or we didn't hear that much about it, and people are much more aware, and I think protect themselves more in general than we did 60 years ago.
Right. I mean, nobody knew. I mean, I was one of those kids with this blonde hair and blue eyes that slapped a combination of baby oil and iodine all over myself trying to get
Sure.
a tan, because my little dark-haired girlfriends were getting tans and I was just getting burned.
Right.
So, nobody told us. We didn't know, and I've often wondered why my mother didn't put something on me.
Right.
All right. So fair-haired people
Mhm.
do have a tendency.
Fair-skinned people, and of course, blondes, redheads, kind of in the top of
Right.
that category. But yes, because the lighter your skin, the faster you will burn, and of course, it's when you do the burning you do the most damage. The question always comes up, well, if you just get a tan slowly, it's safer. It's still not a good thing.
Right.
But it's safer to do that than, 2 or 3 big burns,
Another question I was going to ask you is, do you see it more often in elderly people? But you would expect to see it more often.
Correct. And the thing I tell patients is the effects are cumulative,
Right.
so over a lifetime. So sometimes we'll see a patient who exposed themselves to the sun for 30 years in their job and then never went out again, but the damage was done early on. So when they get in their 60s or 70s is when they might have problems with this. There are other agents that also seem to induce skin cancer that we don't see that often. People who work in industries where caustic substances are used. I can think of a couple patients who did that, and one man told me that after he worked in this for 25 years, they stopped using this one solvent because they thought it might cause skin cancer. We removed several skin cancers from him.
We just don't know.
Right.
There's so many agents out there that you run into. All right. Now, I read that there are specific skin cancers that originate from each layer of the skin.
Right, and they're kind of named for that, or at least the basal cell and the squamous cell. The basal is the base or bottom layer of the epithelium, and most basal cells will arise from that, where the squamous cell arises in the epithelial cells themselves. And hence, I think it has to do with their name.
Is skin cancer fatal?
Yeah, it can
That's
be
a broad
fatal.
question.
It can be fatal. And of course, the different types have different prognoses, even from early on. Basal cell is generally a slow-growing lesion. It rarely invades deeper structures, but it can, particularly with lesions that are ignored for long periods of time. And sometimes we'll see lesions that have been present 5, 10, 15 years. They're more likely to, say, involve a nerve sheath and then become very aggressive. Squamous cells depends on their location. The mucous membranes or interoral squamous cells seem to be and are much more aggressive than those that occur on the skin. Any of these can become invasive, and when we talk about melanomas, that's the one that we worry about most, because fairly early it can become a deep lesion, and then it has a poor prognosis if it's beyond a certain level.
What percentage of skin cancers are melanomas?
About 2 to 3%.
So that's low.
Correct. I mean, yes, unless you have it.
And then it's
high.
a big concern.
And yet, again, I saw a statistic that said although it's only 2 to 3% of skin cancers, there are about equal numbers of deaths from melanoma as there are from squamous cell and basal cell, which account for 98%. So those two, the more common ones are less lethal than, say, the melanoma is.
So, you know, people tend to think, oh, it's just a skin cancer. You know, it's no big deal. It's just a skin cancer. And I guess if you stack it up against lung cancer, maybe it's you can look at it like that, but it's still a big deal. It's still a cancer.
Correct. And if somebody sees a spot that is not a dark spot, meaning if we think it could be a squamous or a basal cell, a delay of a week or a month or a couple of months most always would not make any difference, assuming it hasn't been ignored for years and years.
Now, how about, I heard some statistics that I'm not sure about that said if you have as many as 5 really bad sunburns as a child, that your possibility of developing skin cancer is increased by 80%. But I don't know how those statistics are arrived at.
Right. You had sent me some of these questions. I read that and kind of laughed, and I said, how would you measure that?
Right.
I mean, it's fair to say the more exposure you get at any time, and certainly when you're young, and particularly the bad burns, the reds and the blisters, would increase your risk. I don't know about that statistic that said 5 and above, it's 80%, right. But it's fair to say the more exposure, the greater is your risk.
You've brought some really ugly pictures. They're not attractive at all. But Phil, if you'll put...
And this is a far advanced basal cell. You can see it has a raised border and a large ulcerative area, and it's just below the eyeball on the eyelid. This one most likely has been present for 10 years or more.
I can't imagine not going and checking on something that looks like that.
This is a more characteristic. It almost has a gray-white appearance. If you take the skin and stretch it over it, it becomes very gray-white. More times than not, with basal cells, particularly ones that are raised up above the skin and referred to as nodular, what you see is what you get. The patients are always asking me, does it have deep roots and that? And the answer is they generally do not. That if you remove the entire lesion, then you've cured the patient from that tumor. This one is, if you can't make that out, that's a nostril rim, and it's a pigmented basal cell. And you can see the dark areas, the irregular areas, and it would be easy to misdiagnose this as a melanoma. It's hard,
that's what I would have
hard
thought
clinically to tell what it is. This is a more characteristic elevated nodular basal cell carcinoma. This one has, smooth margins and is raised up. Sometimes they'll have what's referred to as neovascularization, new little blood vessels that you can actually see within the lesion. This one is a little bit less characteristic. There's a type of basal cell that's referred to as morphea. It's flatter, and it can sometimes be more extensive than it clinically appears. Also, the crusting you see on the surface is something we also see with squamous cell carcinoma. So this type of lesion will require a biopsy to know definitively what it is. And this is actually a more characteristic. I had looked at this close up, but at a distance it just looks like a little red spot, but it's an elevated lesion, pretty characteristic of basal cell. And again, this one is a little bit difficult to say. If you look carefully at the margins of that lesion, they do appear to be raised, or at least to me they do, but this one also could be a squamous cell or a basal cell, in my opinion. I assume we're moving into the next category, because this lesion is a malignant melanoma. There are several characteristics you can see: the asymmetry, the different shapes in the same lesion. This bottom one looks like a hemisphere, and then also the multiple colors, the light colors, dark colors, almost reddish colors in it also are characteristics of melanoma. Asymmetry is one of the hallmarks. Lesions over 0.6 or 6/10 of a millimeter is also one of the hallmarks of malignant melanoma, and the variation in color in uneven margins or spiculated margins we'll see sometimes in these. Again, here you can see the multitude of different colors from red to dark brown there.
And shapes.
Asymmetry, yeah. Another one, most all these will have irregular borders and multiple colors. This is a little bit difficult to read, but it talks about the things that we mentioned: the multiple colors, the asymmetry, the irregular borders, and then the size. And from this distance, it's hard to say, but I think this was a melanoma. It looks like it would be an early lesion. It's not large, and I really can't tell about the borders or the multiple colors from this distance. Again, suspicious lesion with the multiple colors, asymmetry, and irregular borders.
Do you usually find melanoma dark, or can it be?
Yes, and this one is listed as a melanoma. There is a melanoma that's referred to as amelanotic melanoma, and occasionally you'll see something like this that looks like a benign mole or nevus, and when it's biopsied, it proves to be a melanoma. But you'd be hard-pressed, or I would be hard-pressed, to call this a melanoma by its clinical appearance. It's only by histopathology. And now I think we're moving into the squamous cell carcinomas. These we see in, of course, tobacco users will see them on the lips, cigarette smokers, pipe smokers, people who dip tobacco. They're more commonly in the mucous membrane that they're seen. Squamous cells very often will have a crust on them, as this one does. You have red margins, and then they're covered by a superficial crust, or eschar as we call it. Again, same here. This is on the helix, or this portion of the ear, and you can see that the crust on there. Another, same thing, red margins, elevated crust. Yet another of the same.
You know, I think in people that you go to church with, or that you see at a party, those are the things that you see most often, if you have any sort of training at all.
Early squamous cells on the mucous membranes like this oftentimes will just be an ulcer or thinning of the skin, and people say, well, my skin, breaks down, then it heals, then it breaks down again and heals, and if you have this pattern, then it is a suspicious lesion. A lot of the lesions we'll see on faces and on hands are precancerous. They're referred to as actinic keratoses, and it's hard to predict at what rate they're going to advance and become skin cancers, but they deserve evaluation and treatment as necessary too.
Hey, you know, I hear every summer people say, I'm going to the tanning beds. No problem, they don't cause cancer. How dangerous are tanning beds?
Well, it's fair to say they're dangerous. Okay. The tanning beds boast that they only have the UVA rays, and supposedly the UVB are more dangerous from standpoint of causing skin cancer. However, the research in dermatologists tell us both of those can cause skin cancer. The UVA may be not as bad as the UVB, but it's reported that they increase the rate of skin aging. So no matter which you're most worried about, that tanning beds are dangerous. And what happens too is the exposure and the amount of exposure. And my understanding is to achieve a similar tan, that the risk from sun versus tanning bed is similar, even though it's primarily the UVA rays.
And the risk is significantly decreased if you use some that comes in a tube and is a cream, correct?
To my knowledge, yeah, I haven't seen anything that any of those cause skin cancer.
Right. All right. Now, I remember you told me that a skin cancer is really present for a while before it becomes visible and detectable.
That is correct, because most of them will start with a single cell that begins to grow abnormally. And I've heard it predicted it may be as long as 2 years with some basal cells in that until it becomes of a size that is clinically recognizable, that it would be maybe, I'm trying to think of what size to tell you, the tip of a ballpoint pen or something like that.
How, you know, what kind of, now your treatment, your major treatment for this is what?
Excision is the primary treatment. There are some other treatments that can be used for superficial lesions, such as freezing. There are chemical treatments in the form of ointments that are used. Most of the treatment using that are done by the dermatologist. As we're surgeons, we do mostly the excision. Another treatment for some of these lesions is to radiate them. So radiation is also a treatment for it. Most skin cancers, I think it's fair to say, are treated by excision and then radiation, and chemical ointments are pretty far down the line as far as treatment. And they generally aren't as effective that the topical treatments as excision is for more advanced lesions.
What's the recurrence rate?
Right, that's a difficult question to answer because it depends on a couple of things. One, was the entire lesion removed before? There's a type of excision referred to as Mohs, M-O-H-S, where the Mohs surgeon will actually map the lesion, and he examines the entire periphery of it, so that if he looks around the periphery and sees it extends to, if you think of a clock face, to the 6 o'clock margin, he'll go and take more from that. If you have a report of clear margins, particularly in Mohs surgery, I've heard that the recurrence rate is estimated at less than 2 or 3%, 98% sure you have it all. However, as I tell patients, if you have a basal cell on your face or cheek, you know that area has been damaged by the skin, and all that tells us is you've removed that one. And you may be developing others surrounding that or anywhere on your face or hands at the same time. So oftentimes it's difficult to know, is that a recurrence or is it a new or de novo lesion that was coming up anyways?
We only have about 2 more minutes, believe it or not. I wanted to know if you had one thing that you could say to this audience about skin cancer, what would that be?
The single most thing would be to protect yourself from sun exposure. And then beyond that, surveillance, examining yourself or having a physician examine you if you notice suspicious lesions, and do it at regular intervals.
Would you suggest a skin exam with your annual physical for those people who get that? Right.
Family physicians can certainly look at your skin, and if they believe that there's areas of concern, would then refer you to a dermatologist or a surgeon who might treat these.
Tim, I thank you so much for coming on and sharing this with us here in the middle of the summer when people really need to be using their sunscreen and taking measures not to be out at the hottest part of the day and that kind of thing.
Exactly.
I think seeing these pictures are frightening enough,
Right.
you know, that,
right.
that people will take it to heart.
And early detection for all types of
Right.
cancer is the proper treatment.
Thank you again.
You're welcome, Linda. Thanks for having me.
I hope you've enjoyed tonight's show. My next show will feature a small local club who does some pretty miraculous things for our community. Thank you for watching. Have a wonderful evening. Good night.